Lemborexant is a dual orexin antagonist indicated for the treatment of sleep-onset and/or sleep maintenance insomnia. In this video, let's find. What is lemborexant? What is lemborexant used for? Contraindication. What are the side effects of taking lemborexant? How does lemborexant work? How to use lemborexant? What is lemborexant? Lemborexant, sold under the brand name Dayvigo, is an orexin antagonist medication which is used in the treatment of insomnia. It is indicated specifically for the treatment of insomnia characterized by difficulties with sleep onset and/or maintenance in adults. The medication is taken by mouth. Lemborexant was approved for medical use in the United States in December 2019. It is a Schedule IV controlled substance in the United States and may have a low potential for misuse. What is lemborexant used for? Lemborexant is indicated for the treatment of adult patients with insomnia characterized by difficulties with sleep onset and/or sleep maintenance. What is lemborexant? Lemborexant, sold under the brand name Dayvigo, is an orexin antagonist medication which is used in the treatment of insomnia. It is indicated specifically for the treatment of insomnia characterized by difficulties with sleep onset and/or maintenance in adults. The medication is taken by mouth. Lemborexant was approved for medical use in the United States in December 2019. It is a Schedule IV controlled substance in the United States and may have a low potential for misuse. Side effects. Side effects of lemborexant include somnolence or fatigue. Combined preferred terms of somnolence, lethargy, fatigue, and sluggishness, 6.9% at 5 mg and 9.6% at 10 mg versus 1.3% for placebo, headache, 5.9% at 5 mg and 4.5% at 10 mg versus 3.4% for placebo, and nightmares or abnormal dreams, 0.9% at 5 mg and 2.2% at 10 mg versus 0.9% for placebo. Less common side effects include sleep paralysis, 1.3% at 5 mg and 1.6% at 10 mg versus 0% for placebo, and hypnagogic hallucinations, 0.1% at 5 mg and 0.7% at 10 mg versus 0% for placebo. Pharmacodynamic. Lemborexant promotes sleep by antagonizing the actions of wake-promoting chemicals in the brain. Episodes of complex sleep behaviors, e.g. eating food, having sex, making phone calls, have been reported in patients using lemborexant. These events may occur in hypnotic-naive and hypnotic-experienced patients, and patients are unlikely to remember these events. Patients exhibiting complex sleep behaviors should discontinue lemborexant immediately. Lemborexant may carry some risk of abuse, and should be used with caution in patients with a history of alcohol or drug addiction. Its controlled substance schedule is currently under review by the Drug Enforcement Administration. Side effects. Side effects of lemborexant include somnolence or fatigue. Combined preferred terms of somnolence, lethargy, fatigue, and sluggishness, 6.9% at 5 mg and 9.6% at 10 mg versus 1.3% for placebo, headache, 5.9% at 5 mg and 4.5% at 10 mg versus 3.4% for placebo, and nightmares or abnormal dreams, 0.9% at 5 mg and 2.2% at 10 mg versus 0.9% for placebo. Less common side effects include sleep paralysis, 1.3% at 5 mg and 1.6% at 10 mg versus 0% for placebo, and hypnagogic hallucinations, 0.1% at 5 mg and 0.7% at 10 mg versus 0% for placebo. Pharmacodynamic. Lemborexant promotes sleep by antagonizing the actions of wake-promoting chemicals in the brain. Episodes of complex sleep behaviors, e.g. eating food, having sex, making phone calls, have been reported in patients using lemborexant. These events may occur in hypnotic-naive and hypnotic-experienced patients, and patients are unlikely to remember these events. Patients exhibiting complex sleep behaviors should discontinue lemborexant immediately. Lemborexant may carry some risk of abuse, and should be used with caution in patients with a history of alcohol or drug addiction. Its controlled substance schedule is currently under review by the Drug Enforcement Administration. Dose. Insomnia. Indicated for insomnia characterized by difficulties with sleep onset and/or sleep maintenance. 5 mg PO no more than once per night, immediately before going to bed, with at least 7 hours remaining before planned time of awakening. May increase dose to maximum of 10 mg based on clinical response and tolerability. Safety advice. Lemborexant pregnancy category B3, dose. Insomnia. Indicated for insomnia characterized by difficulties with sleep onset and/or sleep maintenance. 5 mg PO no more than once per night, immediately before going to bed, with at least 7 hours remaining before planned time of awakening. May increase dose to maximum of 10 mg based on clinical response and tolerability.